Hi friends, good evening and welcome to my channel Mokambika Nursing. Friends, in this video again we can see the next set of questions from community health nursing, as we already completed two part, that is syllabus wise question discussion from community health nursing. First part and second part we already completed. Here we can see the next set of questions. Question number 36. Rubella vaccine was discovered in the year. And options are option A 1960, option B 1962, option C 1950, option D 1952. Question is rubella vaccine was discovered in the year. And the correct answer is option B 1962. Move on to next question. Pertussis vaccine was discovered in the year. Options are option A 1921, option B 1923, option C 1927 and option D 1937. Here correct answer is option B 1923. Pertussis vaccine was discovered in the year 1923. These two questions are from milestone in vaccination. Okay, milestone in vaccination is important area. So I will do a golden point section. In that I will include all milestone in vaccination. Okay, this is an important area. Read once before going exam. And the next question, which among the following is an example for inactivated or killed vaccine? Options are option A diphtheria, option B yellow fever, option C Japanese encephalitis vaccine, option D mumps vaccine. Here correct answer is Japanese encephalitis vaccine. Question is which among the following is an example of inactivated or killed vaccine? One of the example of killed vaccine is Japanese encephalitis. These killed vaccines or inactivated vaccines include bacterial killed vaccines and viral killed vaccines. Bacterial vaccines include typhoid, cholera, pertussis, meningitis and plague vaccine. Viral killed vaccines or viral inactivated vaccines include rabies, sac polio vaccine, influenza vaccine, hepatitis B vaccine, Japanese encephalitis vaccine. Okay, so Japanese encephalitis vaccine is an example for inactivated or killed viral vaccine. Okay, so option C is the correct answer. Move on to next question. Immunity develops in measles vaccination from. Options are option A 7 days after vaccination, option B 5 days after vaccination, option C 11 to 12 days after vaccination, option D 15 to 21 days after vaccination. So immunity develops in measles vaccination. That is the question. So correct answer is option C 11 to 12 days after vaccination. So here measles is a highly infectious disease in childhood caused by myxovirus. Okay, and this immunization, usually the vaccine is given, reconstituted vaccine is administered in single subcutaneous route. The vaccine is given in subcutaneous route and the dose is 0.5 ml. In measles vaccination, the immunity develops in 11 to 12 days after vaccination. And this immunity will be lifelong or long duration. It will be till lasting lifelong, most probably. Okay, and this one dose of vaccination, that is 0.5 ml vaccination, will give 95% of protection to the child. Okay. And the next question, incubation period of smallpox is. Options are option A 5 to 10 days, option B 7 to 17 days, option C 3 to 7 days, option D 15 to 21 days. So correct answer is option B 7 to 17 days. Usually incubation period is about 12 days and the range is from 7 to 17 days in smallpox. The smallpox is an infectious disease caused by variola virus. Move on to the next question. Chances of perinatal HIV infection to the baby is. Options are option A 85%, option B 50%, option C 30%, and option D 20%. Here correct answer is option C 30%. So here the infection from mother to baby is, that is the question. So there is a chances is 25 to 30% in perinatal HIV infection to the baby. 25 to 30%. Here option 30% is there. So that is the correct answer. In case of breastfeeding, there is from mother to fetus, the transmission is 5 to 20% in case of breastfeeding. And during the unprotected sexual intercourse, there is a chance of occurrence of this HIV is 87%. That is the most common transmission is through unprotected sexual intercourse. And in case of occupational exposure, 1 in 300 people. In case of this infected needle, there is a chance of 25 to 30%. That is while we are giving injections or pricking needles, that is 25 to 30%. During the time of blood transfusion, there is a chance is 95 to 100%. Then person to person, 95 to 100%. Here from mother to baby is 30%. Okay. And the next question, the constant presence of disease within a geographical area is known as. Options are option A pandemic, option B epidemic, option C endemic, and option D epidemiology. So here correct answer is option C endemic. Endemic means the constant presence of disease or an infectious agent within a given geographical area or a population group. Okay, that is known as endemic. First option pandemic is there. Pandemic means an endemic usually occurs in a particular continent or in a whole world is known as pandemic. Okay, second option is there epidemic. Epidemic means the communicable disease or the specific infection occurring in a particular community is known as epidemic. The next question, an outbreak of disease in an animal population is known as. And our options, option A exotic, option B epizootic, option C enzootic, option D epornithic. Here correct answer is option B epizootic is the outbreak of disease in an animal population. Here epizootic means an outbreak of disease. Outbreak of disease means it's an epidemic disease occurring in animal population is known as epizootic. It's an epidemic outbreak. Okay, and the second option is there enzootic, that is option C. Enzootic means an endemic outbreak. Okay, an endemic disease occurring in animal population is known as enzootic. Epizootic means epidemic disease occurring in animal population. That is the difference between epizootic and enzootic. Okay, for example anthrax, rabies, brucellosis, and ticks, typhus, all some examples. Option A exotic disease means disease which are imported into another country is known as exotic disease. And option D epornithic is there, that is the outbreak of disease in a bird population. Okay, that is known as epornithic. And the next question, injectable contraceptives are usually administered through. Options are option A IM route, option B IV route, option C subcutaneous, option D intradermal. So here correct answer is option A IM route. Injectable contraceptives are usually administered. The most common route is IM route, intramuscularly. And the next question, Hind Kusht Nivaran Sangh is a part of. Options are option A antidotes activities, option B anti-leprosy activities, option C anti-tuberculosis activities, and option D all of this. Hind Kusht Nivaran Sangh is a part of anti-leprosy activities. Option B is the correct answer. Related to leprosy, important point is National Leprosy Control Program was started in 1955 and National Leprosy Eradication Program started in 1983. Control program in 55, eradication program in 83. That is an important point regarding leprosy. Okay. Move on to next question. A number of sputum specimen collected to diagnosis of tuberculosis in dots is. Options are option A 2, option B 3, option C 5 and option D 6. Number of sputum specimen collected to diagnosis of tuberculosis in dots is 3 specimen. Option B is the correct answer. The next question, in which year NMCP National Malaria Control Program changed to National Malaria Eradication Program? And our options, option A 1955, option B 1953, option C 1958 and option D 1960. Correct answer for this question is option C 1958. Okay, National Malaria Control Program in 1953. Okay, and it changed to National Malaria Eradication Program in the year 1958. 1953 and 1958. Both years are important. And the next question, when was the first case of COVID-19 reported in India? And options, option A December 30, 2020, option B January 30, 2020, option C February 1st, 2020 and option D February 12, 2020. And the correct answer is option B. As we all know, option B January 30, 2020 is the correct answer. The next question, in which year first polio immunization program was launched in India? And options, option A 1985, option B 1992, option C 1995 and option D 1990. First pulse polio immunization program was launched in India in the year 1995. Okay, option C is the correct answer. And the next question and the last question in the series. First choice of disinfecting large quantities of water is. Options are option A bleaching powder, option B perchlorine, option C chlorine gas, option D all of this. And the correct answer is option C chlorine gas, which is used to disinfecting the large quantities of water. Option C is the correct answer. So far, here we discuss some selected questions and important area from the community health nursing, and I included important questions in this all three videos, first part, second part and third part. So I hope this video will be useful for your exam. Thank you for watching my channel. One request is please subscribe my channel and support me.